Continuing our journey into the realm of precision medicine, it's a privilege to welcome you once more to this enlightening session. In our previous encounter, we unveiled the core principle and potential of precision medicine, a groundbreaking approach that tailors healthcare strategies to each individual's genetic blueprint and unique biological traits. This transformative departure from the one size fits all model is poised to reshape the landscape of medical care. Today, we are honored to be joined again by the esteemed Dr. Suhas Kirti Singla, a medical oncologist and head at Positron Multi-Speciality and Cancer Hospital in Rohtak. As we delve further into the domain of precision medicine, we'll explore its intricate tapestry, gaining deeper insights into how it's reshaping patient care, propelling research, and forging a path to the future of healthcare. So, welcome, Dr. Suhas. So, my first question is, can you elaborate on the role of genetic profiling and molecular diagnostics in identifying targeted therapies for various medical conditions under the umbrella of precision medicine?
This is one of the very important aspects of precision medicine. Rather, I must say that the precision medicine is actually localized to the genetic profiling and molecular searching for the molecular targets in especially in oncology patients, because as we all know that around 20 years back the journey started when we started with the therapy against the HER2 receptor in breast cancer, where actually the molecular targeting started. And then we had rituximab, and after that the things have evolved with a lot of targeted agents like cetuximab, bevacizumab, and multiple others what we can name about. So this helps a lot in making the decision and preventing the patient from various side effects which are associated with other drugs which had been used previously in treatment of cancer patients. And that is how we are nowadays, and now in these present scenarios, helping the patient to actually get treated in a better way with a better survival, and without having those harmful effects.
Yes, doctor. And how do you foresee the integration of artificial intelligence, machine learning, and big data analytics enhancing the practice of precision medicine in the near future?
So that is going to be a boom as such. Now the world is worried whether artificial intelligence will actually take over the presence of physician, but it is not going to happen because human body is very different, and even certain side effects which does happen with certain drugs are not very well written or documented, but they have to be detected. And artificial learning is actually dependent on particular amount of knowledge which they already have acquired, and yet they keep on learning. That is what machine learning is, and that is beautiful as such, because that helps you understand in a better way, and you have actually a better record to understand whether now this patient may or may not develop such kind of side effects. For example, there are certain drugs which have been now 30 years into the pipeline and had been used for treatment of the patient. So you have certain phase 4 studies for them, where you come across that the patient developed some amount of adverse events which were not documented during their phase 3 trials, but when they came into the clinical practice, then the physician as well as the patients came to know about those side effects, and then certain drugs were withdrawn from the market because of the same. So that is how it is going to evolve, and artificial intelligence is obviously going to help us in many of the areas of precision medicine. One of them is the greatest one is the diagnostics, where MRI, for example, MRI, that is in detection of prostate cancer. Artificial intelligence is going to change the scenario altogether, because in MRI, MPMRI, that is multiparametric MRI, the reading of artificial intelligence has helped to detect and to declare many patients free of prostate cancer even without biopsies. And this has helped the patient in prevention of unnecessary biopsies, and has also helped in detection of early prostate cancers, which can help in a better prognosis. So I foresee it as a big achievement, a big help in the future. And I think artificial intelligence is going to be a support, is going to be rather a main benchmark for us to continue giving our best of the treatments to the patient, and will help us rather than being a threat to us.
Yes, doctor. Indeed, it has potential to revolutionize healthcare while focusing on intricacies of disease themselves. So, doctor, in the context of rare disease, how has the precision medicine improved diagnostic accuracy and provided renewed hope for patients who previously had limited treatment options?
Yes, so this is a very important question. As we already talked about a syndrome called carcinoma of unknown primary syndrome. So earlier it was only on the basis of immunohistochemistry, that is the protein presentation on the outer cell membrane, which helped us to understand what is the tissue of origin. Now what we are trying to do is we are now trying to understand the disease in its eternity by knowing from where it has originated on the basis of the genetic makeup of the disease. So that helps in understanding the type of the tissue, and sometimes it also helps in treating the patient with those drugs which are helpful in treating the cancer originating from that tissue. So this helps the patient to survive for much longer as compared to what is thought of with the help of conventional chemotherapeutic drugs. And secondly, if we talk about other rare syndromes, there are many other rare cancers which are yet not very much explored. In those cases, we don't know that what can be the targets which can be used. In such a scenario, whole exome sequencing using the next generation sequencing techniques is going to help these patients a lot, because in that case, if you find some amount of targeted agents or some target which can be targeted well with certain amount of certain drugs, then it's going to revolutionize the treatment of that patient. And so there are many examples of such patients who have survived for even in stage 4 have survived for many years together, just because we were able to find a target to which a targeted therapy was given, and the patient responded to it beautifully.
Yes, doctor. And this approach has provided new avenues of hope for patients who have long struggled with limited treatment options. Now, doctor, what are some recent findings in pharmacogenomics research? And how is precision medicine leveraging this knowledge to optimize drug dosages and reduce adverse reactions in individual patients?
If I talk about in pharmacogenomics, thou precision medicine has yet not revolutionized a lot. It has not been able to find a lot of genes which can be used for understanding the adverse events. But yes, there are certain, for example, TPMT. Whenever we have to give a drug called thioguanine or 6-mercaptopurine, in those scenarios, TPMT is one of the major gene which should be known. Another is DPD, dihydropyrimidine dehydrogenase, which is important whenever we use any fluorouracil associated compounds. So these can be utilized, but their availability is very limited. So, but yes, precision medicine does have a potential in finding some amount of genes which may help to understand how we can improvise the patient's outcomes by providing with the drugs where they can have lesser amount of side effects as compared to the regular doses.
Yeah, and doctor, moving ahead, how does precision medicine influence the decision making process when selecting the most appropriate treatment regimen for patients, particularly in cases of complex diseases like cancer?
So that is the best part of precision medicine actually. So precision medicine not only helps us, but it also helps the patient to understand the disease better. Once you actually get a target, so you are able to convince the patient better. You are able to tell the patient about the prognosis on the basis of the drug which you can provide to the patient. There are certain times when the drug is actually not approved for that particular condition. In that scenario, we can utilize the drug for that particular target in the form of targeted therapy, but sometimes those things do wonders. For example, gallbladder cancers. These cancers are more common in countries like ours, Chile, and other Southeast Asian countries. So a lot of research has not been there in Western countries over this. So with the advent of NGS, HER2 was found to be very much proliferated in these cancers. So people started using anti-HER2 agents, and then the trials were pursued. And when the trials, it was found that using anti-HER2 in patients who are HER2 positive is going to help them a lot. And we have seen patients who are on maintenance with anti-HER2 therapy that they live much longer as compared to their routine counterparts who haven't received those therapies or who lack HER2 amplification. Now, this clearly tells us that a patient who was actually HER2 positive and was going to have a bad disease responded beautifully to a anti-HER2 therapy, and and that is where the precision medicine actually helps the patients a lot. And then another example is stomach cancer. HER2 has been found to be proliferated in stomach cancer. So anti-HER2 therapy has been used in those cancers, for example, TOGA trial, and it was again found to be very much effective and has helped a lot of patients in maintaining a good response and attaining a good response despite of the fact the stomach cancer was used to be one of the very poor prognostic cancers. So that is how precision medicine is evolving and is evolving continuously. We have a lot of newer indications on daily basis for various cancers, and the previous agents are also now being tested in newer conditions, and these are being applied clinically for providing better outcomes in the patients.
And now, can you discuss any emerging trends in immune profiling and immunotherapy research? And how are these findings shaping the design of precision medicine interventions for cancers and autoimmune diseases?
So this is another era of revolution for oncology as such. Immunotherapy is going to revolutionize oncology as a whole. Rather, I think in future it will be immuno-oncology rather than oncology as such, and we are going to have a different branch altogether. I think in 10-20 years down the line. So why is it so? Because immune profiling, as you said, immune profiling is basically understanding that how can a particular cancer respond to the immunity of the body. So now to understand that, we have few markers like PD-1, PD-L1, but still it is an area of active research, because still these are very much lacking. Certain patients who have 90% of PD-L1 expression do not actually respond to the anti-PD-L1 therapy. So this is because they have other receptors which are working over there and causing the resistance towards anti-PD-L1 therapies. So still we are trying to find out that what other receptors can be helpful and what in totality immune profiling has to do with, to understand that how we can help them in a better way. Now what immunotherapy is going to revolutionize is that we are now actually looking towards a survival of more than 3-4 years, even 8 years with the help of immunotherapy, because immunotherapy actually what it does is it actually reminds the immune cells of your body how to fight against the cancer cell, which they are unable to do in absence of the immunotherapy. So that makes a cell in the body. Memory cell means that retains the memory how to fight against it, so it keeps on fighting for a very long period and thus helping the patient to survive for much longer.
Yes, Doctor, and thank you for sharing your insights into the emerging trends. And as we approach the conclusion of this session, Dr. Suhas, I would like to express my gratitude for your informative and engaging contribution. Your insights have enriched our discussion.
Thank you.
And a huge thank you to our audience for joining us today. But before we wrap up, allow me to draw your attention to the MedSynapse platform, our dynamic hub that's reshaping the healthcare landscape. This invaluable resource is tailored for dedicated professionals like you, providing avenues to partake in meaningful discussions, connect with experts, and drive healthcare progress. Explore the MedSynapse platform right now to seize these exceptional opportunities. Feel free to share your questions in the comment below. We'll be more than happy to provide you with the answer you seek. I am Dr. Harshita, your host, signing off. Bye bye.